with it. Now, just before you watched that, we were listening to Dr. Kwasi Boahene. He's Director of Health Systems at Farm Access. Bit of a technical issue there. So we're going to have him very patiently just restart that delivery for us.
No, so thank you very much for hosting this event, which I think is of critical importance to the country, and certainly huge appreciation to our partners, Ministry of Health, Ghana Health Service, National Health Insurance Authority, HEFRA, Christian Health Association of Ghana, Greater Accra Regional Hospital is here. We work with academia. Professor Nkrumah represents the University of Ghana. We also have patient advocates. Ghana National NCD Alliance is an important player in these efforts. So huge appreciation on my part for the work that you've done and keep doing, and also huge appreciation that we've been able to partner with them to get this efforts going. So as an organization, Farm Access, which I represent, our mandate and of course objective is to ensure that everyone in Africa will have access to healthcare. And we do that by partnering with key institutions across Africa. So Ghana, we work with the partners I mentioned. We have a fantastic team in Ghana, headed by Dr. Masua Antwi. And our focus is how do we use innovations and data to drive change in healthcare. I always tell people that 25 years ago, nobody imagined that mobile technology will be able to transform Africa the way that we've done. 57% of Africans do not have bank accounts, but they can do business due to mobile payments, or we call them mobile money in Ghana. So our conviction is that if mobile technology has done this for financial inclusion, can we also use mobile technology to transform health and tackle NCDs? The answer is yes. So we committed towards that. Now we are here talking about NCDs. Why is that important? Ghana, as one of the members of United Nations, has signed the UN Declaration on Universal Health Coverage, meaning that 2030, which is 6 years from now, every Ghanaian will have access to basic healthcare without any financial burden. That is the aspiration of the country. And they are working hard on it. And I can confidently say that if I compare Ghana with other African countries, Ghana has made good progress over the years. But there are challenges. One of them, and if we want to achieve USC, is to tackle NCDs. What you said is perfectly right. If I walk on the streets of Accra and I meet 100 people, 43 of them will die of diseases associated with NCDs. And most of them don't know. So you cannot blame the healthcare, the policymakers. You cannot blame the healthcare providers, but we all have to come together to make this work. The picture is glooming when you listen to the World Bank. That says that if we don't take immediate action now, by 2030, Ghana will spend $6 billion every year on tackling NCDs. That is a cost that as a country, which is aspiring to be a middle-income country, we cannot afford to ignore. So we all have to be part of it. And having us here to have that conversation, and I'm really inspired that if you want to address this in a comprehensive manner, we need to engage experts from across the board. That's why we are here with academia, with healthcare providers, with policymakers and patient advocates to really drive home and mobilize efforts to achieve or defeat NCDs. So that is important for us as an organization, it's important for the country. And we've seen how, because some people cannot pay for care, they are pushed into poverty. That has to stop. You know, so, and in conclusion, what I would also like to emphasize that I'm glad, you know, also based on your introduction, that this dialogue is actionable. We'll focus on actionable solutions. That is what we need. You know, awareness raising, early detection, prevention, treatment, and above all, building support systems to help people. You know, this, we call it dialogue, but it's more than a conversation. It's a call to action that we all have to embrace. And we are proud to be doing this with our key partners in the country. Yeah.